Hey everyone, welcome to this explainer. We're going to completely demystify modern HIV prevention today. Specifically, we'll be looking at that critical timeline before and after a potential exposure. If you've ever felt totally overwhelmed by all the medical jargon out there, you are absolutely in the right place. We're going to break down these incredible biomedical tools using simple, everyday language so you'll know exactly how they work, when they're used, and what options are actually available to you right now. Here's a quick look at our agenda for this explainer. We've got 1. The HIV Prevention Toolkit. 2. PrEP, protection before exposure. 3. PrEP options, pills and shots. 4. PEP, the emergency response. And finally, 5. PrEP versus PEP. Let's jump right in. All right, Section 1, the HIV Prevention Toolkit, shield versus fire extinguisher. So what exactly are PEP and PrEP? You've probably heard these acronyms thrown around in clinics, maybe while scrolling through social media, or even on the news. But what do they actually mean? Well, both are highly effective medical strategies to prevent HIV, but they're used in entirely different circumstances. To really keep them straight in your head, I want you to visualize two very different safety devices. First up is PrEP, which stands for pre-exposure prophylaxis. Think of PrEP as your ongoing proactive shield. This is a medication you take before you even step onto the battlefield. It's designed for people who currently do not have HIV, but want to make sure that if they are ever exposed to the virus, their immune system already has this armor in place to block the infection. Honestly, the pre is the absolute most important part of that word. It happens beforehand. Then, on the flip side, we have PEP, post-exposure prophylaxis. Now, PEP is your emergency fire extinguisher. You don't just walk around carrying one just in case, right? You only grab it, pull the pin, and squeeze after a spark has already flown. It's a reactive measure. You take it only after a specific, isolated event where you think you might have actually been exposed to the virus. Moving on to Section 2, PrEP, protection before exposure. So who exactly is this shield for? Basically, PrEP is designed for folks who don't have HIV, but whose lifestyle, relationships, or behaviors might involve some potential risks. This could mean you have a sexual partner who has HIV, maybe you don't consistently use condoms, or you have multiple sexual partners, or even share needles. The whole goal here is simple. If you have potential exposures in your life, this is a tool specifically designed to keep you safe and just give you that peace of mind. Now look at this. Here's a truly staggering fact. When taken correctly and exactly as prescribed, PrEP reduces the risk of getting HIV through sex by more than 99%. That is an absolutely massive level of effectiveness. The medications essentially build this impenetrable wall around your immune cells. So if the virus enters the body, it hits that wall, literally cannot multiply, and just dies off. But, there is a catch. The absolute most important factor here is adherence. The shield only works if you actually remember to hold it up. If you skip doses or stop taking it entirely, the level of medication in your body drops. That wall comes down, and you lose that 99% protection. It really is that simple. Okay, Section 3, PrEP options, pills and shots. The great news is science has given us incredible flexibility to fit different lifestyles. First, we've got the traditional daily pill. You just take it once a day, every single day, kind of like a vitamin. Second, there are on-demand pills, which you only take around specific sexual events. And finally, we have these real game changers, injectable shots. Instead of taking pills at all, you can visit a clinic and get a shot every 2 months, or with some of the newer medications, even just every 6 months. This is absolutely amazing for people who maybe struggle to remember a daily pill, but still really want that continuous high-level protection. Let's look a little closer at that on-demand option, because it's actually pretty fascinating. For folks using the on-demand pill method, often called the 2-1-1 schedule, it involves some very specific steps surrounding a sexual event. Step 1, you take a loading dose of 2 pills between 2 and 24 hours before sex. Step 2, you take 1 pill exactly 24 hours after that first dose. And step 3, you take 1 final pill 48 hours after the first dose. Doing it this way ensures the medication spikes in your system exactly when you need it and stays high enough afterward to clear out any potential virus, all without needing to take a pill every single day. All right, let's fast forward a bit to Section 4, PEP, the emergency response. So what happens if you weren't on PrEP and something goes wrong? Maybe a condom breaks, there's an unexpected exposure, or in cases of sexual assault. Well, PEP is the tool you need. Now, unlike PrEP, which usually relies on just 1 or 2 drugs, PEP is a heavy-duty 3-drug emergency toolkit. You have to take it for a strict 28-day course to stop the virus before it can permanently establish itself in your body. It's a pretty intense regimen, for sure, but it is incredibly effective at preventing an infection if you act quickly. And here is the absolute most critical public health takeaway of this entire explainer. You only have a 72-hour window. Look, HIV doesn't instantly become a permanent infection the second it enters the body. It actually takes time for the virus to navigate to your lymph nodes and rapidly multiply. That process takes roughly 3 days. But once the virus establishes a hidden reservoir in the body, it cannot be cured. PEP works by flooding your system with drugs to stop that process before it finishes. But seriously, you cannot wait. I want you to think of this as a ticking clock. At hour 0, the exposure happens. Ideally, you really want to start the medication within 24 hours. But once you hit that 72-hour mark, that emergency window forcefully slams shut. By then, the virus has likely established itself, and the emergency medications just won't be effective as a preventative measure anymore. And remember, if you do start in time, you absolutely must complete the entire 28-day course to make sure the threat is fully eliminated. Let's wrap things up with Section 5, PrEP versus PEP, the summary comparison. Let's bring everything we've talked about all together. On the left side, we have PrEP. This is the proactive 1 to 2 drug shield you maintain over time, whether that's daily, on demand, or via injections. Then on the right side, we have PEP. That's the reactive 3-drug fire extinguisher you trigger immediately after a crisis, which absolutely must be started within that strict 72-hour emergency window. It really comes down to the shield versus the fire extinguisher, before an exposure versus after. Hopefully, by stripping away all that heavy medical jargon, you now have a solid understanding of these incredible biomedical tools. Science has literally given us the power to effectively end the transmission of HIV. But these tools only work if we know how and when to use them. So, knowing the difference between the ongoing shield and the emergency fire extinguisher, are you equipped to protect your sexual health?